Good evening and welcome to the Mary Washington Healthcare Facebook Live event. This is Jeannie Burkett in the Marketing and Communications Office, and we're talking this evening with Dr. Dennis Halmy and dietitian Meredith Hill. We're going to be talking tonight about the surgical weight loss journey, and there are so many facets related to that. We thought perhaps there was an audience in our community who might be interested in knowing just a little bit more about not only surgical weight loss and what that entails, but the preliminary events that happen before surgical weight loss and what it's like afterwards. So this is the first segment of a two-part series. We'll also be introducing you to a patient next week on Thursday, March 15th, again at 8 p.m. So if you're interested, please come back next week. But let's get started tonight. And first of all, I'd like to introduce you to Dr. Halmy and Meredith, and let's get right down to it. So tell us a little bit, Dr. Halmy, about who should be considering weight loss surgery.
Well, thank you, and I'd like to welcome everyone. I'm Dr. Halmy. I'm a bariatric surgeon, which means that I do weight loss surgery. So I've been doing this weight loss surgery for the last good 18 years or so. And I've been pretty busy, so lots of surgeries, and I am very happy that I had many patients who were very, very successful, and I was able to be part of this amazing journey. So I'm very pleased that we offer these services here now at Mary Washington, and we have this opportunity now to see patients here locally and offer the surgeries here. So if somebody is struggling with weight, which is a pretty common problem here in the United States, and tried different weight loss plans and couldn't succeed, there is an option to choose weight loss surgery. Now, weight loss surgery is not for everyone. I mean, obviously surgery is a pretty drastic step. You have to be well prepared, and you have to be very motivated and very careful when you go onto this journey. But I'm very happy to tell you that we have experts here who can help you all the way from the beginning until you lose your weight, but more importantly, until you are very stable and maintaining your healthy weight. So if someone needs to lose at least 80 pounds or more, and if you tried losing weight on different weight loss plans and you couldn't succeed, this is one option that you should consider. Weight loss surgery is highly successful. Most of those who undergo this procedure can expect to lose at least 70-80% of their excess weight, which means that if you're 100 pounds overweight, you need to lose at least 70-80 pounds after weight loss surgery. That is what we expect to happen. Now, weight loss surgery is definitely a long process. It's not something that one can just decide and go forward with it. We are very careful to make sure that before surgery we have careful discussions with patients about their options, about their health history, and about the different types of surgeries. Following the operation, we have a very carefully planned follow-up visits with the surgeon, with our dietitian. We give advice about exercise. We give advice about how to modify your lifestyle, because our ultimate goal really is not just to help you to lose the weight. The ultimate goal really is to make sure that you will be able to maintain that healthy weight permanently. And so we built this program around this concept. So I'd like to ask Meredith to give us a little overview what we do before surgery.
Yes, hi everybody, I'm Meredith. Honored to be here with Mary Washington Hospital and Dr. Halmy. I've been working with Dr. Halmy for 3 years now, and it's very exciting to be able to see everyone go through these amazing transformations. It definitely takes some hard work. You know, the weight loss surgery is a tool. I always tell patients, it's a tool, but we help you to use your tool the right way to help you reach your goal, whatever that might be, to really help you maximize your weight loss. But it definitely involves some dietary changes, some exercise, some lifestyle modifications, like Dr. Helmy said, some really, creating healthy habits. And that's what we help you do, because this is not a quick fix. It is a lifestyle change. But it is so worth it. Some of the benefits, we call them non-scale victories with patients. One of the biggest benefits is more energy. Just they get their life back in general. There's so many. I could go on and on and on about the all the positives that come after weight loss surgery, but it's worth it. Get started.
So let me tell you a little bit about just generally what is the concept or how this success happens. So if somebody needs to lose weight, especially if you need to lose 70, 80 pounds, which is a significant amount of weight, we all know that the only way to lose weight is to change your eating. And basically what you need to do, you need to limit how much you eat, and you need to choose foods that are very low in calories but contain healthy nutrients. Now, in order to lose 80 pounds or more, you really have to very drastically reduce the amount of food you eat, which is very difficult to do. I'm sure most of us, many of us, try different diets, and you can do it for a while, but after a while, somehow with the hunger, the appetite, the cravings, it's not really maintainable to stay on such a diet. So this is the reason why those who need to lose 80 pounds or more, the success with any type of medical weight loss program is very, very low, because you cannot maintain it long enough, that very restricted diet, to lose that much weight. So the idea with the weight loss surgery is that we are going to make some changes surgically in your digestive system, in your stomach or the intestines, which will change this whole game. Because what happens now, after we make those alterations, your hunger, your appetite, and cravings will decrease. And if we make you a very small stomach, a very small food portion will fill that stomach. So you quickly get satisfied, even though you are really hardly eating anything. And because of that, your hunger and your appetite will be always at a low level. So it will be easy, or easier, it's not an easy thing to do, but it will be much easier to stick to the diet, because you are not urged by your own cravings to sort of go off the diet, because you will be content with these small food portions.
That's right. So one of the things I have to urge patients after surgery is, yes, you might not feel hungry, but it is still important to eat. You have to eat to fuel your body. Eating on a regular schedule is very important. Three small meals a day, and you get your two protein supplements in there as a general guide to the way you eat. You're not going to probably feel hungry, but it's important to fuel your body.
And again, going with the same idea is that obviously our body needs a certain amount of nutrients. So the protein is very important, vitamins are important, and water, liquids. So after weight loss surgery, those are the things that you have to be focused on to make sure that you maintain your hydration, your protein intake, take some vitamins. And also you need to maintain physical activity, because we don't want you to get weak. So if you stop using your muscles, you will end up some of the muscle lost, and that leads to weakness. So basically, we have a very detailed plan how to prevent any nutritional deficiencies or vitamin deficiencies following these operations. But before we go there, I would like to talk just a little bit about the surgeries, because I'm the surgeon, so this is kind of fun for me to do and to talk about. So The good news with surgery is that I've had this experience over the past 15, 20 years doing surgery, that surgery is getting less and less invasive. What that means is that we do not make big cuts and we don't have to do these long, big operations. Now we have very sophisticated technology. We have the laparoscopic equipment. We have the robotic equipment here at Mary Washington that we can use for these procedures. What that means is that we can accomplish the same procedures that in the past we used to do open, meaning through a big cut, through these little tiny buttonhole size incisions. What that means that the pain is minimal following the operation. You should be able to get up, walk around the same day. Most patients leave the hospital the following day, and you can return to work within 2 weeks or less. So the operations are, however, pretty serious. One of the procedures that we do more frequently now is called the sleeve gastrectomy. Sleeve gastrectomy is a procedure where we make a small stomach. We remove about 80% of the stomach, leaving you with a small 20% narrow, long stomach. What this will result in is that small stomach gets full very fast. All you need to eat is maybe, half a cup of food or so?
Yeah, about 6 months out, it's about half a cup of food per meal. Mm-hmm.
And then you feel like you had a nice dinner. Mm-hmm. And that fullness will last a couple of hours, so your hunger and cravings are gone. This surgery, the sleeve gastrectomy, the advantage of this procedure is that it doesn't change how the food gets digested or absorbed. So we don't alter that part of the digestive process. So the nutritional side effects are less than with some of the other surgeries. The Roux-en-Y gastric bypass, which is one of those operations that has been done for the last maybe 45 years, is a very successful procedure. It has very high success for weight loss, but it's a little more complicated than the sleeve gastrectomy. With the gastric bypass, in addition to making a small stomach, we bypass part of the intestine, so not all the calories that you consume will get digested and absorbed. So this will add to the weight loss. This will make it a little more successful. Patients with the gastric bypass may see a little faster weight loss than with the sleeve gastrectomy. But then it has a little more side effects. It does have a little higher risk of some nutritional deficiencies and some issues with certain foods that may not agree with you. So the main reason why patients do well with this surgery is, though, not the particular kind of surgery. The main reason is because after the procedure, patients change their eating, change their behavior, and adopt to a new lifestyle. And that will assure that the weight loss will be permanent. Maybe Meredith can talk a little bit about the vitamins and the other things you need to take.
Yeah, so definitely the specific vitamin recommendations vary based upon the surgery that you choose. And we will certainly cover that at your visit before surgery. We'll help you, guide you to good brands, bariatric specific brands that are going to help meet your needs and prevent any deficiencies from happening. And it is very important to stick to some of these special formulations that are designed to meet your needs after bariatric surgery. So that's one thing we'll make sure you're doing after surgery. Yes, there's a question.
Yes, we do have a question.
Okay.
So we have a question from Jennifer. She says, can a person with a colostomy have this done?
Okay. Well, so anyone who had surgery in the past, any kind of surgery, I'm talking abdominal surgery, there is always some scar tissue, some alteration of the anatomy. So that makes it a little more complicated sometimes to do weight loss surgery. But generally speaking, the answer is yes. So if you had some prior surgery, definitely we're going to have to go over the details of what type of surgery you had. And then we can make some recommendations as of which weight loss procedure would be the safest. So somebody who had a colostomy can have weight loss surgery. Probably the sleeve gastrectomy would be a good option.
Great.
I think so.
Okay.
So let me go back quickly to the surgeries. So everybody wants to know how much weight can I lose, how fast am I going to lose the weight, and what happens when I lose so much weight. So basically, generally, the weight loss is very fast. Initially, in the first couple of months after surgery, we see a pretty strong weight loss between 10, sometimes 15 pounds a month. It depends a little bit, obviously, how heavy the person is. The more the weight is at the onset, at the time of surgery, the faster it will come off. But generally, by the 6 months after surgery, we see at least 50, 60 pounds of weight loss in most patients. Mm-hmm. And then the second half of the first year, the weight loss will kind of slow down. We see about 4 to 8 pounds a month weight loss. And generally, by the end of the year or maybe year and a half, most patients level off. So weight loss will stop. But then usually by that time, you will be pretty close to your goal weight. Now, the side effect of this quick weight loss, unfortunately, can be a little surprising. Because if somebody loses that much weight in a short time, you will encounter some excess skin. And usually the excess skin is something that if you lose the weight faster, it will be a little bit more visible. So generally at the end of the first year, most patients have pretty significant laxity, we call it looseness of the skin. But the good news though is that with exercise and healthy nutrition, skin care, that will improve. So there is always improvement. So if you look at those patients 2 or 3 years later, the loose skin usually will improve a little bit. Now some other side effects, maybe those are more related to nutrition. Maybe Meredith, you can talk a little about.
Yeah, so definitely, loose skin is one of the side effects that, can certainly happen. The main one I get asked about is hair falling out. Am I going to lose all my hair? And there's a lot of factors that go into that. And really all I can say is you can control the controllables. So, make sure you're following our recommendations, make sure you're staying hydrated, make sure you're getting in the minimum amount of supplemental protein, and you're choosing very nutrient-rich foods. I really advise people to eat real food sources, and even now including, small amounts of healthy fat. That's going to be good for your skin, your gut health, your brain health, and hair too. And there's some other supplements, but also taking your vitamins and minerals that we recommend. So if you follow those, you can definitely minimize some of the common side effects. Okay,
So, Dr. Halmy,
yes.
So if someone is interested in this type of weight loss surgery, what is the important criteria to look for when looking for a surgeon or a program?
So you have to, if you're considering weight loss surgery, you need to think about it not just the operation. So really this is not just about the surgical procedure. Of course, it's very important part of this plan because the surgical procedure is kind of the high risk part of the plan. But in order to be successful, you will need a good, experienced team that will work with you. So the dietitian, someone like Meredith who has years of experience working with weight loss surgery patients. You need a good coach who is a behavior expert who will help you, because during this weight loss, especially at the beginning, these changes in your diet have a lot of impact on your everyday life. So sometimes it can be a challenge how to cope with certain things without being able to eat the usual way. So you need to have somebody who will support you, a behavior coach. You need to think about exercise, because as you lose more and more weight, you need to keep exercising and you need to keep increasing your exercise. So you need somebody who is part of the team who will help you with guiding you with exercise. And you need to have a lot of support. So in order to be successful, you have to have this whole plan that again starts way before your surgery and basically does never end. So you need these guys, these people to be around for you later. We see patients years after surgery who return because they have some concerns. Sometimes they start gaining weight. Sometimes they're having some other stomach problems. So you need a group, a team who is around, who is available for you. So it's very important. Sometimes I see patients who leave the country to go to some other country to get their weight loss surgery done. And I always feel a little sad that you don't really get a good service. I think going somewhere away to get your surgery, obviously financially probably that's an advantage, but then you will miss so many things that are so important. And your long-term success really depends on the support, the education, and the availability of help. So that's what you need to look at. You need to find a place, a team that you like. It's kind of, we are having sort of a long-term relationship. And obviously we like to be happy. And, it makes us very happy when somebody loses weight, when somebody is successful. And obviously those individuals who are able to lose the weight and maintain the weight are very supportive of each other as well. So we develop this community, which is really priceless. So I think that's what you need to look for.
Yes. Dr. Halmy, I'm sure that some of our listeners are wondering, this must be really expensive. And if I do this, is my insurance going to pay for it? So if you wouldn't mind, just go into a little bit about some of the expenses that might come up doing surgical weight loss and the services that are provided before and after. And will insurance pay for some of this or all of it?
Okay, so generally speaking, health insurance does provide coverage for weight loss surgery. There are some criteria that you have to be at a certain weight, or what we use is the body mass index, or BMI. So if somebody's BMI is over 35 or over 40, generally health insurance pays for weight loss surgery and some of the related services. So majority of the expenses should be covered by insurance. Now, unfortunately, there are so many different insurance plans, and some insurance plans are a little better than others, so it's a little bit different what is included or what is covered or not covered. But generally speaking, I think 80% or at least so for the expenses will be covered by insurance, at least the medical expenses. Now, additional expenses that you will encounter will be some of the nutritional, the exercise, the vitamins, and some of the supplements. These are usually not covered by the health insurance plans. But again, majority, the hospital, the surgery, and the medical testing should be insurance covered.
And some of the out-of-pocket expenses I can write a letter of medical necessity for, so you get reimbursed from your health insurance. So just be sure to ask about that. Yeah. Any questions?
So I think we're going to wrap up for this evening, but again, for those of you who are listening or watching, we are going to be meeting again next Thursday, March 15th at 8 p.m. again. And we will have a patient here who has gone through surgical weight loss to talk a little bit about what the experience was before, during, and after. And Dr. Halmy is going to join that person. So I think we can really get into some deep conversation about what it was really like. So if you're interested in more information, we're going to put the Health Link number up there. It's 540-741-1404. You can call them if you're interested in learning a little bit more about surgical weight loss and some other information resources here in our community. So Dr. Halmy and Meredith, please accept our gratitude for being here this evening. I'm sure we've got lots of people out there who have been so happy to hear about some of the nuts and bolts about surgical weight loss. So thank you very much for being here this evening.
Thank
Good
you.
night.
Thank you.
Thank you.
See you next week.
Good night.